All right, welcome everyone. Thank you for joining us. We're here for a question and answer session with Marcia Stickel, all about the COVID-19 vaccine. So Marcia is joining us today. She is a retired nurse and also a member of the State Disaster Medical Advisory Council committee. And they have been getting all kinds of details about the vaccine over the last couple of months. And so Marcia has a great deal of information to share with us. And she and I have talked through some questions that are very common questions that we're going to answer. And then if there's time at the end, we will answer any questions from the audience that you can type into your chat, into the chat box. But if you want to go to the next slide, Alyssa. So these are the topics we're going to be covering today. We'll talk about the safety of the vaccines, when it will be available to people to receive the vaccine. We'll talk a little bit about herd immunity, which is a term we're probably going to be hearing a lot of in 2021. We'll talk about the different vaccines that are coming out. And also the question everybody wants to know the answer to: when will life get back to normal? I know you're all dying to know about that. And then a couple of other questions that we've received about when people will get to go back to work, and what happens if you're unable to get vaccinated. So those are the questions we know we're covering. If you have other questions, feel free to put them in the chat throughout, and we'll try to save a few minutes at the end to answer any last questions. And then we'll just go to the next slide, Alyssa. Oh, look at that, I said that already. I also want to make sure we're very clear. This is being recorded on December 15th, starting at 1:30 p.m. New information about all of these vaccines is coming out by the minute right now. So this is what we know as of right now, and things are changing very quickly. Also, even though Marcia is a nurse and has a lot of medical experience, she's not going to be dispensing any direct medical advice. So if you have specific medical questions, the best person to talk to about whether or not you should get the vaccine is going to be your doctor. So with that, Marcia, we will start with this first question. Is it safe for my loved one with a disability to get vaccinated with the COVID vaccine?
Yes. And so the general answer is it is safe. There's been a lot of concern and worry about could it possibly be thorough enough because it has come down quickly, very quickly, compared to past vaccines that have taken years to develop. And there are a couple of reasons for that, which I don't really need to go into detail, except to say part of it is there was a lot of funding from the government. So they took more risks, moved faster, spent more um, money on scientists to work on things and to get testing done. Um, the science is there for it to be safe. During clinical trials, there were 2 months of watching people after they were immunized or given the other one that was nothing. It was a placebo, and so they monitor for 2 months. This is the third phase of trials. So they followed plans just exactly like they have in past testing of vaccines. And during those clinical trials, side effects were minimal. And we have been informed by experts right here in Wisconsin that said this is what they always do. They check for 2 months. Usually with vaccines, if there's going to be any significant side effects, they will come to light in that 2 months. So I feel confident I'd go right now and have an immunization if I was in the first group. I'm not, however. So the only side effects that were frequently cited are side effects like you would have had with a flu shot. And hopefully you've had your flu shot this year. I'm giving a push for that as well, where you might have a little bit of soreness in the arm and you might feel a little achy, maybe have a real low grade small fever, or feel tired for a day or two. That's the kind of side effects that you see when you have a flu vaccine. And that's what people who've had the COVID-19 immunization have also reported. Now, going to COVID-19 itself and the disease symptoms, you probably already know because you've seen in the news, those disease symptoms are far scarier or could be for some people than any possible vaccine side effects. So, again, yes, safe. If you have any doubt because of something, we'll go into that later, maybe certain conditions or whatever, then check with your physician because for most people, it's very safe.
Thanks, Marcia. Um, do we want to go to the graphic that shows what's in the vaccine itself?
Sure. Yeah. Do you have that? Can you bring that up?
Yeah,
Okay.
there we go.
So the one that has been approved, that's the Pfizer BioNTech. That was approved and is now being given out. You've probably seen pictures. This is what's in it. It's kind of scared people because it's been talked about that it's an mRNA. Well, what does that mean? People know that we are made up out of DNA, and so they've got all worried. Some people have gotten worried. But basically, what it is, as you can see here, that the active ingredient is a viral spike from the virus, and it's the coding. So it's the directions about it that are then put into a medicine so that your body responds just to that and builds a defense system. And so your immune system says, aha, this is a baddie, this is the villain. We're going to be prepared for it if we should get the virus. And so, as it says, this is the message for our cells to produce a viral protein that will trigger immune response to the virus. And then the other long, if you've seen the ingredient list, it's a long list of lots of syllables of names. But basically, the salts, which are a buffer, so that's typical. Lipids are fats, so they encapsulate it to make it stable, and a little bit of sucrose or sugar. So, and that's to keep it from getting too sticky. So, it's an injection, it's a liquid, and that's what's in the liquid, and it's all kept very carefully at minus 94 degrees, and then you don't have to worry about it, but the medical professionals process it after that to give an injection in your arm, in a muscle, and you will still be the same person, but your body will be prepared to fight against the virus if it needs to.
Great. Thank you, Marcia. And before we started recording, you mentioned too that there's not any live COVID virus in the vaccine itself,
Right.
right?
Of all the vaccines that are being tested, there are no vaccines that have the live virus in it. So there is no worry that you're going to get COVID-19 from an injection of a vaccine.
Great.
So availability, well,
Yeah.
it's pretty exciting. This week, people are getting shot, right? We're glad they're getting in England, they call it a jab. I don't know which is, I kind of like the thought of a shot, I think, instead of a jab. But anyway, so that is something that I've worked with quite a bit with the we call it SDMAC, State Disaster Medical Advisory Committee. And the concern was, how do we make sure the vaccine's going to people who need it the most? And actually, the FDA also, they were working on it. Really, it's been across the whole country. And the consensus was healthcare personnel need it first and foremost. And then in our state, how did we define that? That's where we got more involved with that. So it basically includes who you would typically think of, the nurses, right? I think of the nurses right off, but not just the nurses, all the people who have direct contact in hospitals, people who are driving ambulances, people who are working in home care. Those are all direct care health personnel. HCP, you'll see it in some places, healthcare personnel. And then the second group that gets priority are people who are living in nursing homes. So right now, the vaccine is going out, healthcare personnel, and then nursing homes. And I don't think nursing homes are getting any this week. I think that we are going to be seeing healthcare personnel first, um, and then in nursing homes. And that's a big group. So 400,000 people estimate of healthcare professionals, and then plus the people in nursing homes. Um, One estimate, and this can change, depends on Moderna, how soon it comes on board. If it does, looks like it will next week. Um, Depends on how much can be shared out, but an estimate was by the end of February, those two groups will have been adequately covered with immunizations. And then we'll have the next group. So there's multiple phases, and you have that slide too, don't you? So that would probably be a good, yeah. So you can see phase 1A, then phase 1B, people of all ages with comorbidities and underlying conditions that put them at significantly higher risk, and older adults living in congregated or overcrowded settings. So, not just nursing homes, could also be other places like group homes. But notice the comorbidities, because when you're asking, what will people with IDD be able to get them sooner? It depends on what their diagnoses are, really. So, um, again, I would encourage um, individuals and their loved ones to be advocates and to be checking with their doctors in advance, asking about, can we get the vaccination sooner because of such and such and such and such. Um, so that puts a person in a higher risk, and it might be a little more subtle than what's written on here, because if a person's unable to wear a mask because of challenges, if they have some habits of things like putting their hands in their mouth, if they would have a lot of challenge if they were hospitalized, I think all of those things should be factored in and addressed. And the best way to do that is to get the ear of whichever health professional you think will be listening, um, to that, for that need. And then you'll see that the phases go on. So phase 2 would include people with kind of essential people, what we call them, um, including teachers. So there's a lot of people, including my grandchildren and their parents, who are eagerly awaiting um, all the teachers and bus drivers and custodial staff, all of those people getting immunized, so that then the children can go back to school, because it seems the biggest problem or concern for in-person school is the staff, not the children. So you can see all of these. Will these slides be left up where people can see them? Yeah.
Yeah.
So you can see over time. I mean, phase 3. So if a person's healthy, doesn't have any other chronic diseases, would probably be in phase 3, or possibly phase 4. So when you're going to get it, um, it depends really on what your personal situation. But it could be March, could be April, May. Um, like I said, can't give you a specific because it's personal. And you won't be able to get vaccinated. Just like with your flu shot, they always say, "Are you sick?" You can't have an immunization if you're sick, and so that would be the same. Um, and then the other thing to keep in mind for the shot, for these first two vaccines at least, you will need a booster. The second shot is absolutely extremely important. I've read the data on both of them. So with Pfizer, the one that's now approved, you must come back in 21 days to get the second shot. And with Moderna, you must come back in 28 days. So 3 weeks or 4 weeks. And it's very, very important. It's crucial that you get both of them. So that's something you want to just have in your mind. Um, and there's going to be more and more, as there's more availability, there's going to be more options as far as where to get it. Pharmacy definitely is going to be a possibility. I just talked to a friend of mine last night. In fact, the one who gave me that information about the vaccine, she's a pharmacy tech, not a pharmacist, but a pharmacy tech. And she's getting her training right now to give injections. So she lives out in rural Wisconsin. So definitely there's going to be plans for different ways to get immunizations. There's going to probably be drive up group sites as well. And so keep your eyes and ears open, and be looking for what will work best for you or your loved ones.
Marcia, can I ask a question about that 21 and 28 days?
Yes.
I know there's a lot of concern about what if there's not vaccine available on that 21-day mark? Is it, will it not be effective if somebody gets it after the 21 or 28-day mark?
That's I haven't seen any
Okay.
information on that, but this much I know. Um, like the vaccine that's being sent out now, it is mandatory that the same amount of vaccine is available for the in 21 days.
Mhm.
So they're not sending, they're making sure that there is enough so that people will get it. Now, that's not to say what if somebody broke their leg and can't get to the clinic on the 21st day. That's a different thing.
Mhm.
Um, I That's such an interesting question and a very
So
good one.
yeah, I was part of a call last Friday, Marcia, with some of the folks from the Department of Health Services in
Uh-huh.
Wisconsin, and that question came up.
What they say?
Um, and the answer was you're not fully immune until you have the second shot, but
Right.
that 21 and 28 days is the minimum number of days
Very
between the
good. Well, that's
doses,
good to know.
but not a maximum. That there,
Okay.
if you aren't able to get it exactly that day and get it a week or so later, or at some point in the future, that's okay.
I imagine there's going to be a limit on that, but
Hmm.
that's really good to know.
Hmm.
So I will. Who mentioned it? Do you know who it was?
Uh, it might have been the DHS vaccine expert, Stephanie Schultz.
Okay,
Is
well
that her
that's
name?
great. I'll look it up because
Okay,
I didn't have that information,
sure.
and it's super important.
Yeah, yeah. And
Okay.
then we did have a question from Amy that I think we can go ahead and answer now. Thank you, Amy, for the question. So um, the question is individuals who provide care at home for a family member with a disability,
Mhm.
um, are they considered a home-based uh, health worker um,
Yes,
under, yeah,
that is
okay.
how we're defining it. So
Okay.
that may not be the same in other states, but that is how
Mhm.
we're defining it in Wisconsin.
Okay. And in which phase would those individuals be able to be vaccinated based on your
High risk health
understanding?
workers is my understanding.
Okay.
And
Okay.
the tricky part of that, sometimes the devil's in the details, right? But
Mhm.
hospitals, it's really straightforward. They get the
Mhm.
vaccine, they give it to their staff. Home care workers, where do they get the vaccine from?
Mhm.
So that's the tricky part because your primary care physician is not going to have it at the beginning. So if you're not able to get it through a hospital center, then how are you going to get it in the phase 1A?
Mhm.
That that could be the challenge.
Right.
Um,
Yeah, I understand that the nursing homes are working with either CVS or Walgreens or
yes,
another pharmacy.
yes,
So it's possible that maybe those institutions will also then open up for um,
right. In
care
fact,
workers.
so if if you're paid, if you're an employee of an agency that's working homes as a home staff member, that they might be able to set up something um, with one of the pharmacies too. I think where it could get a little complicated right off the bat to get it early is if you're a family member caring for one person, a loved one, that you might have to make some calls and see what
Mhm.
the options are.
Okay, thanks, Marcia.
Yep.
All right, we can go to the next slide. Should I wait to make sure the vaccine is safe before I get it?
I think for most people, you're going to have to wait anyway. Now, we just talked about those people who can get it early on. Um, so there will probably be a few things that show up when you have millions of people getting an injection versus 40,000. Um, so you if you're not getting it until the end of February, you've already had millions of people get the injection before you, as far as statewide and even nationwide. um, but I don't think, personally, like I said, I would get it today if I qualified. I don't think it's necessary to wait to make sure it's safe. You certainly could. Some of the people who might want to wait are people who um, are children, pregnant, immunocompromised because they're on chemo or they have had a kidney transplant, or people with an autoimmune disease. Only because those people were not in the original testing groups. However, I would caution you again, you've heard this how many times already, to check with your physician, because when the medical professionals were talking about the Pfizer vaccine and kind of picking apart the data, numbers of the doctors said, "Oh, well, I know that it doesn't say that pregnant women have been tested, but in my experience, there are people that I care for that are much more at risk for the COVID-19 virus than they would be for getting the immunization, the vaccine." So, if you're in that category, I would still encourage you, if you have one of those chronic illnesses, to check with your doctor to see if he or she feels that you should go ahead and get it, and not wait until there's been more testing on those groups.
Thanks,
And
Marcia.
one
Oh, go
other
ahead.
thing, people who've
Mhm.
had COVID-19 already and it's been verified, they know they have. Um, you can be vaccinated. Absolutely. They encourage people to get the vaccine. But in general, you may want to wait until other people have had the vaccine, since you probably have some antibodies to it because you already experienced having the disease. Again, you could go ahead. There's nothing to prevent you from getting the vaccine if you've had COVID-19.
Thanks, Marcia. Okay, we're going to talk about herd immunity now. What is it and when will it happen?
That's such a catchword, and that had gotten a lot of political play. Um, I really like what Dr. Temte, and again, Dr. Temte is a doctor in our community in Madison. He has a lot of credentials behind his name and has been very active working with multiple kinds of vaccines over the years. Um, and he gave a really good explanation of when herd immunity could happen in Wisconsin. And so you have that slide. So you can see if the vaccine is given, if 56% of people take it. So you start from the right and go over. Um, and I am very sad to say right now, the very recent poll just came out. Right now, 47% of people said they would take the vaccine. 27% are unsure. So that's a maybe. We hope that they change their mind as they see people taking it and being fine. So, anyway, if we can get 56% of people to get vaccinated, get immunized, and the vaccine is 90% effective, which both Moderna and Pfizer fit that grouping, then you get an equal vaccine induced immunity of 50%. If we have 10% of the population in this orange section at the top who have had the COVID-19 and are immune because of that, the total would be 60%. That could be herd immunity. And that would be the low end. He's being pretty hopeful. I've seen lots of numbers that were higher, that you needed like 70% to have herd immunity. But he's hopeful that if 60% are immune, that then we'll have that herd effect. So when will that happen? That's hard to know. Like I said, it depends on how many people step up and say, yes, I will get the vaccine. It's just really clear. This graphic shows that very well. Um, we're hoping by summertime, or I guess I'm really hoping by the time school starts in the fall, that we'll have herd immunity. But this is where all of you can make a difference. If you get it, if you encourage others to get it, the more people that get it feel safe and brave and willing, the sooner we can get back to having a more normal uh, lifestyle again, by having herd immunity.
Marcia, do you want to talk a little bit about what the term herd immunity means, or what
Sure.
people should think
So
about?
I
Yeah.
know it's odd, isn't it?
Are
What
we
it
all
means,
cattle now, or?
yeah, right. So the idea behind it is, if enough people cannot get sick with the virus dies out. The virus can't continue to spread. It has nowhere to go to continue. Right now, we know how infectious it is, and so many people, even young people, have it, don't know they have it, and then share it unknowingly. So if people, that's why it's so good for people who are the most at risk, if they get the vaccine first. But also, we want young people to get it too, so that all across all populations, the virus can't survive because it can't find hosts to continue to spread. That's what herd immunity does.
Thank you, Marcia. All right. Which vaccine is the best one?
I think over time, there are going to be even more vaccines. Um, Johnson and Johnson is the one I've heard that's coming up next. There's been a couple where they're back to the drawing board because there were some problems, but there were like 180 different vaccines that were being tested and worked on initially. And some of them I wouldn't recommend, the Chinese one or the Russian one, just because we don't have data on how safe they are. But I think some vaccines will be good for those who only who do much better if they only have one injection, and that there are some coming down the line eventually that only need one injection. Um, but for the most part, I think um, all of the vaccines, they're going to be thoroughly tested, and there may be one that works a little better. For instance, Moderna works not quite as well for people age 60 and up than the Pfizer one. But it's still like 86%. So it's still good, but it's not 94% like Pfizer. So for me, I would prefer the Pfizer because I'm over 65. So, I think it's again going to depend on what's available to you and then what might best fit your situation. And so it's going to be good to learn about each vaccine as we go along, and if you can't do that, just to check with your doctor to see what their recommendation would be.
So if you're given the choice between two different vaccines,
Hmm.
to work with your doctor
Yeah,
about which one is better for people in your demographic, but if there's only one choice given to you, would you
yes,
recommend
take
people
it.
just take it?
That would,
Okay.
yeah, just get it. That would be my recommendation.
Okay.
And
Thanks.
like I said, if if somebody has no chronic illnesses that are an issue and they are deathly afraid of needles, it might be okay to wait or to try to find out is the next one like for Johnson and Johnson. I'm not sure if you need two injections for that one or not. um it might be good to check on that. But in general, I think you can safely say all of the vaccines are the best ones because they're all better than having COVID-19.
Thank you. Yeah. All right. The question everybody is waiting for, Marcia, and I'm sure you can see into the future and give us a date for this. So, when is life going to return to what we think of as normal?
Well, if I could guarantee that, I think I don't know. I could be pretty wealthy just from just from that information sharing. No, we really don't know. But I really hope that by Thanksgiving, by fall of next year, we can feel safe about having normal returns to school, normal planning for holidays, Halloween, Thanksgiving, Christmas. Um, I really, really hope that will be the case. The reason I kind of hedge my bets is because we're sort of building a boat while we're sailing it in the open ocean. That's kind of what's been the reality of things. And so there could be some things that we don't know about yet that could delay things. For what we do know, and I don't think we've talked about that yet, is that even if you get immunized, you still need to wear a mask. You still need to keep 6 feet apart from others. You still need to avoid large groups. You still need to wash your hands. Don't need to wash your groceries. We've learned along the way that those kinds of things are not a big deal. It's what's in the air. So that still needs to be, and people aren't going to be happy about that, but that's a reality for a long time. I would think expect that until summer at least. And again, I might be surprised. I'd love to be surprised. But even after you've had the vaccine, you need to still wear a mask. You need to be careful that you're not possibly carrying the virus, but you won't get sick because you had the immunization. And but you don't want to share any possibility of it to somebody else who hasn't had the immunization. And there'll still be people out there that are going to be vulnerable for quite a while. We hope fewer and fewer as people step up to get vaccinated.
So that's kind of the normal comes with herd immunity, you could almost say.
Really, yes.
Mhm.
So we can look at Australia, New Zealand. They're careful, but they don't have any cases. They have no active cases. And so they're living normal lives carefully. They don't have to wear masks and they don't have to refrain from groups or any of those things. Um, but boy, they're very, very, very careful about letting anybody into their country, of course. Um, so yeah, that's what it takes. It takes not having any cases.
Okay, thanks, Marcia. What will happen for folks who aren't able to or don't get vaccinated?
Okay, we've talked a lot about herd immunity. Basically, there's a couple sides to this. First of all, nobody's you're not going to break a law if you don't get vaccinated. We live in a free country, so nobody's going to there's not going to be vaccine police or anything like that and saying you didn't come in and um, that's not going to be an issue. But on the other side, until there's herd immunity, you're still going to be at high risk. And so, if many people refuse to get vaccinated, thinking, I'm just not going to, it's going to take a lot longer before things return to normal, before there is that herd immunity. And some people, some places may make some rules about what will work best at a place of work, um, possibly flying if that hasn't been determined, but or if you need a surgery, I could see how that could be a case where they would like you to be immunized. As it is now, they have you take a COVID test right before surgery, and they're still worried that you might be infectious and it doesn't show up yet. So I would expect that if you're going to have um, say a knee replacement or some sort of surgery that you know about and schedule in advance, that you will have to show proof that you've been immunized. It just makes medical sense. um, and likewise, some places of work where it's a problem with spreading in close vicinity of each other, they may require you to be vaccinated. So we'll again, it's another unknown. Can't tell you for sure. Um, but those are some of the possibilities.
Thanks, Marcia. And this question, certainly the staff, the whole team at Love Inc. has been hearing from a lot of the people with disabilities that we support. So can I go back to work? Can I go back to school or back to my normal life routines after I get vaccinated?
So I can say what my thoughts are. You will, of course, still run into this. Um, what does the place of work, the person in charge, say? I think returning to work would be safe for you after getting vaccinated. So, from a personal perspective, yes, you could go back to work. You're going to be safe, very, very high percentage of possibility that you will be safe. You will not get sick. You will still need, as we've discussed already, social distancing and masks and hand washing until we get herd immunity. Or there is this: if you work in an office environment where no visitors come in, and if the policy is everyone has to show proof of immunization, then it may be okay for everybody to be back to normal, if you will, within those doors because everybody's been immunized and no worries. You don't need to wear a mask then. You don't need it. You could hug somebody. But that's if everybody has proof of immunization. So as you can see, we're talking about it depends on the situation. Um, and I really hope, again, back to you, each of you individuals, if you get immunized as soon as you can, the more people who are immunized, the better chance that everybody can go back to work, school, and life. So it really does depend on you as an individual and on your influence with others.
Great. So I'm going to give folks a moment here to type questions into the chat box. But while that's happening, Marcia, I would love to hear from you about, you were saying that we were expecting some news about the second COVID vaccine, the one from Moderna,
Yes,
later this week.
yes. So, two really exciting things. One, yesterday, Governor Evers said that he was hoping 101, it's interesting to me that it's 101,000 doses of Moderna to come into the state next week if it gets approved as he's expecting it will. So that's encouraging. That's a larger amount than what was originally thought would be coming into the state. Then this morning came the news that the FDA did their assessment and of all the data from the Moderna vaccine, and they assessed it as being a big green light and very positive. Like I said, the only thing that is a little bit different is it's a little less effective, 86%, which is still high for people over 60. But 18 to, no, I think it might be 64. I gotta go back and look. Anyway, as people get older, it's less effective. Um, but for most people, it's still in the 90s. So it's really still a great vaccine by all we know. But again, it's very carefully scrutinized. On Thursday, they're going to have that health professionals that pick it apart and discuss it as they did last week with Pfizer. And if they all feel it's a go, they vote. And if they, last week, the vote was 17 yes and 4 no. And the 4 no were just little kinds of things like, well, should 16-year-olds get it? Because they didn't have that much testing. So, anyway, what happens? It got sent out right away. And we're hopeful that on Thursday, there will again be a positive determination by the healthcare professionals. They're independent of Moderna. So it's not a political thing. They are all, it was interesting listening to them. They're all very concerned about their bailiwick, what they think. They're doctors, they're not shy. And, I think we can trust um, their independent judgments. So, yeah, I'm hopeful that next week Moderna is going to start sending it out and Pfizer will continue. And so we're going to maybe have it happen sooner than we thought. I think I heard something about April for the general public, and I thought, well, it's pushing it a bit, but we'll see. Um, I would love it if it was April. Wouldn't that be nice? Celebrate spring with immunizations for the general public. So, again, you can tell I'm really pro vaccine. And for myself and my husband included, I take that personally as well as professionally. We have been so isolated because of our personal situation. My husband has dementia, um, and it would be terrible if either one of us got it and ended up very sick. So um, I'm as excited as anyone else to get the immunizations when it's my turn and when it's my husband's turn and be able to be out and about. But I'm one of the lucky ones because I'm retired. I can isolate, and I have been extremely faithful in doing so. So, what else?
So, Marcia, Amy asks another question about kind of the disbursement of the vaccine. So, um, where will the vaccine, once they kind of get through the initial doses, where they get, all the healthcare workers in the state and people in nursing homes, where will the doses be given? Will they be at drugstores? Will they be in your doctor's office? Do we know much about the plans for that yet?
So right now, we know the immediate plan, and there will be, and we are working on plans for each step along the way. But in general, what we can say is as more vaccine becomes available to wider groups, it's likely to be available at your doctor's office. It's likely to be available through pharmacies. It's likely to be available at mass immunization clinics where people come and queue up um, in cars. It may well be, and I think Dr. or Governor Evers has even spoken about this, having the National Guard help with immunizations. So I think there is going to be a lot of availability in different ways. And hopefully, there'll be sites that you can go to find what will be best. I think there is a site, it's not up yet uh, for COVID. Do you have that? You don't have that one? Let me see. Let me look real quick and see if I can find.
Is it the vaccine tracker, COVID vaccine tracker?
No, it's a website you can go to see where you can get a vaccine.
Oh, I see.
Okay, I
Um,
found it.
okay.
It's a government website. So it's www dot dhs dot wisconsin dot gov slash I it's either LH or IH. I think it's LH
Okay.
dash DEPTS slash. So that's a big old
Mhm.
thing. And that, though, once there's enough, it's not going to help you right now anyway, but that
Mhm.
will be. So you probably want to play with that and see where, if it gets you in, if you got it written down correctly.
Mhm. Yeah,
Um,
we'll share that link if and when it goes live, but I just
right.
posted it in the chat
Right
for folks.
now, it works for like flu or
Mhm.
other vaccines, but it
Mhm.
doesn't have COVID yet because it's not widely available.
Got
But it
it.
would be good to have that information
Okay.
when people need it, but it might be a couple months from now.
Sure. And then there's a second part here for Amy's question about, so let's say it's phase 1B or phase 2, and we think we fit into the category or the criteria for that phase. What kind of documentation is being asked for? Are people going to have to prove that they're an essential worker in some way? Do you know if
Hmm.
there's been thought about that so far?
That has not yet been discussed.
Okay.
Um, I could see that it may be that you would have to show, like, if you have an ID from your work, for
Mhm.
instance, or a pay stub or something, that would show what your job is if you're an essential worker.
Mhm.
Um, it may also be that for larger employers, they'll have a clinic right there at their site. That is what I would anticipate. Say it's meat workers or other factory work kinds of things that are essential, or schools. They might have a Walgreens clinic, uh, immunization clinic right on the spot from Walgreens or something. So um, yeah, there could be. And then as far as getting um, a shot early because of chronic conditions, you can, if you have my chart, you can obtain a list of what your diseases are, your chronic conditions, and print that out and have that available. Um, or you can get a letter from your doctor. But let me tell you, it's a much, in my experience as a nurse, it is much easier to go into my chart and print off your list than it is to get your doctor to write you a letter, unless you have a really unusual doctor who has lots of spare time.
Mhm. So basically, in these first phases, especially in phase one, supplies are going to be so limited to that they are really just looking at people in hospitals or people who work in hospitals
Mhm,
and
mhm.
people in nursing homes. And then once we get into the further phases is when those other kind of folks have to um, are going to be able to get immunized. Is that
Right.
kind
Yes.
of the idea? So
Yes. And I think,
it'll become clear, but it won't
right. There'll be
be
more
heard.
information.
Hmm.
And I think that, you know, it makes sense that people who have factories or whatever, that they're going to be eager to provide that documentation or provide that service right
Hmm.
there.
Yeah. Okay. That's helpful. I'm not seeing any other questions in the chat, so I will maybe I'll wait a minute and see if anybody else has any questions. But I just want to say thank you to Marcia for giving us your time today. Um, oh, we do have one more question from Yasmin. Hi, Yasmin. Glad you're here. I have two jobs, and she listens to CNN News every day from and listens to Dr. Gupta. Um, so she wants to know um, when she can go back to work. So
Ah,
we kind of talked a little bit about that, right?
yeah.
Um, that it could be a while.
Mhm.
Um,
Yes, most likely it's going to be February, March, maybe. So it just takes a lot of patience. And I know
mhm,
that is frustrating. But the good news, we never thought of, couldn't even imagine when we talked about this way back in the spring, that this was going to be so awful and last so long. Though I
mhm,
sort of did expect it, but it's still, the reality is hard. But now, as hard as it is to wait, the good news is we understand that it can get better, and it will get better. We have a plan and we have the medicine to help us.
mhm,
So really, as awful as it is to wait, at least we know there's an end point.
mhm,
And stay strong, stay safe, don't give up what you need to do to stay well until you get the vaccine. It's really hard, and this time of year is really hard not to be
mhm,
with a lot of people that we like to be with, maybe only at Christmas time. I just turned down my family reluctantly
mhm.
to come from Georgia next
Mm.
week because I want to stay safe until we have the vaccine. And as you could tell, it's not
Yeah,
easy,
yeah,
but it's necessary. Stay safe, stay well, and get vaccinated when you get a
yeah,
chance.
yeah. Think that's a perfect note to end on, Marcia. Thank you so much.
Yep.
And this is hard, everybody. This is really hard, but there's nothing more important than your health um, in the world, and so um, that's why this is so important. But I hope that we're all able to get vaccinated in the spring or in the summer of next year. And I can't wait until we can have a big Love Inc. get together when that's safe. So thank
Very
you
cool.
again, Marcia, for your time. Have a happy holidays,
You
and
too.
uh, and we'll talk to you soon. Bye,
Okay.
everyone.
Bye bye.